let's talk about umbilical cords and the benefits of delayed cord clamping, as well as the benefits of cord blood banking. Those are two different things. Um, the World Health Organization does recommend delayed umbilical cord clamping, and what they consider to be delayed is just at least 1 minute after the baby has been born. And depending on your birthing environment, your provider, and of course the birth experience itself, 1 minute might be sufficient. They might let it stay attached for several minutes longer. The idea is to let the umbilical cord continue pulsing blood from that placenta and not cutting it until at least 1 minute after the birth, or until the cord is no longer pulsing blood and still pulling all of those really amazing vitamins and nutrients from that special organ. There are a lot of benefits to delaying that. It can help with the prevention of iron deficiency and anemia. It's not an end-all be-all. It doesn't mean that if you delay the cord clamping that baby won't have anemia sometime down the road, but it does help give baby a better chance at preventing that for sure. And there are benefits for the mother too. Baby stays really close because placenta is close by. Though the placenta has likely been delivered at this point, the placenta can just be laid on the side of the bed or put in a basin, and baby can still be attached to that. Mama can still be holding baby and doing skin to skin, but she can know that the baby is still getting as many nutrients from that amazing organ as possible, that organ that is made only once for each baby. It blows my mind. It's so fascinating. So, and then there's cord blood banking, and that is not something that's done at home, by somebody who comes to you, or something that's done in the hospital. It's something that's done by a cord blood banking facility. The hospital or would have to send the umbilical cord away to have it processed, and it involves the collection of the blood. It's extracted from the umbilical cord, and it's stored for future medical use for that baby and that baby's family. Umbilical cord blood contains just potential life-saving stem cells, which stem cells are building blocks for our blood and for our healthy immune system. And there is a difference between like the freshness of umbilical cord blood stem cells and then the stem cells that are currently in my adult body, because umbilical cord cells are immature because they're brand new, and that actually works in someone's favor in the instance of maybe possibly needing a bone marrow transplant. The immature stem cells actually don't really know to reject the potential transplant, and so those cells are giving the transplant recipient a better chance of success from that. And then those umbilical cord stem cells can morph into other cells that can help fight other diseases and help the organs and the blood vessels and the tissues throughout the body. So it's a really an awesome thing that happens. The umbilical cord is just this one thing that comes per baby one time of pregnancy, and there's so many good things that come from it. One thing to remember too about cord blood banking is it can be especially helpful for the minorities of, for minority populations, but specifically the African American and Hispanic communities, as they are often having difficulty finding a perfect donor match in the registry. But it's thought to be that umbilical cord blood can be a more perfect match for them. It might be a little bit easier to pair them up with that kind of a donation. And then, a lot of this is going to be contingent on your pregnancy and especially the birth. So if there was something that happened traumatically in the birth, or baby needs resuscitation, or mom is in distress or whatever, there's obviously not going to be time to sit around and wait to delay that cord, it's going to be cut, and mom's going to be whisked away, or baby's going to be whisked away and be tended to. So the thought of delayed cord clamping is in an uneventful, healthy, non-risk birth experience. And really the same might apply for the cord blood banking, as if the cord is cut immediately after due to distress or something, there may not be as many benefits from extracting that blood and saving it for later.